You are listening to A Path to New You, a podcast about mental health and veterans issues. Today's episode, I want to talk about therapy. I want to talk about therapy as well as ways to get more out of your therapy session. So, in today's episode, I'm going to explain a little bit what therapy is, kind of what to expect, why, um, if you should, if you think you should go, or why you should not go, some of the steps to looking for a therapist, and things like that. I know some of you may have already been going to therapy. Some of you listening may or are thinking about going to therapy, but have no idea where to start or how to find a therapist. So today's episode, not session, is about it might help you out a little bit. So, what exactly is therapy? Psychotherapy, which is also called talk therapy, is a form of treatment aimed at relieving emotional distress and mental health problems, provided by any of the variety of trained professionals such as psychiatrists, psychologists, social workers, or licensed counselors. It involves examining and gaining insight into life choices and difficulties faced by individuals, couples, or families. Therapy sessions refer to structured meetings between a licensed provider and a client with a goal of improving some aspects of their life. So every time you go to see your therapist or psychologist, it's called a session, which is pretty structured. The critical aspect for therapy is that the client or patient works collaboratively with the therapist and can identify improvement and positive change over time. So there's always a reason why someone would go to therapy. You yourself or somebody you know or anybody would go to therapy. And that is because there might be a situation which you're in, you're just feeling kind of off, or could be something else. I'm going to talk about that a little bit later on. So you ask yourself if you haven't gone to therapy or not in therapy, should I go to therapy? That's one of the first questions you should ask yourself. You know, you might be struggling a little bit, something's off. Should I go to therapy? Most people, regardless of their specific challenges, can benefit from having a licensed professional listen and offer guidance. Because of therapy's costs and investment, however, as well as the lingering stigma, there's that stigma still out there. It's not as bad as it was before COVID, but there still is a stigma surrounding mental health. The decision to begin therapy isn't always an easy one. You're thinking to yourself, should I go to therapy? Will it help me? Will it not help me? And then you got that stigma problem where, you know, before COVID, it was like if you go to therapy, you're considered weak or you're considered not strong. So those are one of the few things you need to ask yourself. Should I go to therapy? Was it going to help me? It's also time consuming. It's also an investment. I'm going to talk about that a little bit later on. To determine whether therapy is the right choice for you, you should consider whether you feel sad, anxious, overwhelmed, or irritable more often than not. If you say yes to this, therapy would likely offer emotional support and help develop the tools to manage your mental health. But strong negative emotions aren't the only reason why you'd go to therapy or seek therapy. If you're struggling with relationships, feeling stuck in your career, finding yourself turning, to drugs, alcohol, or food to cope with unpleasant situations, or you just feel disconnected from the people around you, you may find therapy to be immensely helpful. So, again, if you're struggling with something, you're trying to find ways to cope with a certain situation you are in, you're depressed, you're grieving, something's happening, or you feel like you're using alcohol or drugs more than you used to, and you're finding out that you're using alcohol or drugs to cope with your situation, that would be the time to go find a therapist. One of the first steps to looking for a therapist, there's many different ways to find a therapist. There's all these, they have the online tools like Google searching, Yahoo, Google. There's also a few online directories such as Psychology Today, Psychology Today is one of the most popular ones, where you go in and you would type in say for example, you're struggling with depression. You type in depression, and then you would find all the different therapists who specialize in depression. And then you would also type in your zip code. That would that would also show you what therapists are in your area, in your zip code area, that specialize in, for example, depression. Also, you can, if you have insurance, you can use your insurance company's online list of covered providers. Just talk to your insurance or your insurance website, and you can look up providers, and they'll tell you exactly who takes your insurance. Now, if you're private pay, if you don't have insurance, you could use Psychology Today, which is a free site. You just go in, type in what you're looking for, type in your zip code, and um, and the providers, the therapists would come up. The ones who specialize in that area, the ones who are in your area would come up. So those are two things that you can actually that help to find a therapist. Google search, say depression therapy, and then you can type in your area code too in Google or use Psychology Today. And there's other um, directories too. There's also online therapy like BetterHelp you could use, and that I believe is a monthly fee or a weekly fee, and there's certain things about you need to follow in order to be with BetterHelp as well. So BetterHelp, there's other online therapy. There's other online therapy that would you can work for too, or in person. I don't know what I was trying to say there. So just also asking yourself, what type of therapy is right for me? Many types of therapy have been shown to be effective at treatment common mental health challenges and determining which approach is best for the particular person. There's different types of therapy like cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing. It's just finding out which type of therapy is best for you. That's when you can meet with the therapist that you want to work with, and then you talk about your situation, and then that therapist, psychologist, or whoever it may be, a licensed professional, they'll talk to you. It's like, this is what I would use to help you with your situation. You do that in your first session, which I'll talk about here in a minute. Another situation is, will I be able to afford therapy? Now, if you have insurance, you always use your insurance. Now, if you don't have insurance, you would be considered private pay. So it'd be with credit, debit, check, cash. and that would be considered private pay. The cost of therapy can be expensive. Just think to yourself, would you be able to afford it? That's when you talk to your therapist you want to talk to. Usually, usually in most situations, you can call them and they'll give you like a 10 or 15-minute free consultation where you ask the questions about how much it costs and whatnot during that telephone session. That's usually free. 10 to 15 minutes, usually free because you figure out, is this the right therapist for me? And that's when you talk about the pay and all that. There's some therapists who are extremely expensive and they will they won't budge on their how much they charge. There's some out there who use a sliding scale, which they use they use the how much you make and they use that with how much they'll charge you. Um, it just depends on the therapist. On average, most sessions cost, if it's private pay, they cost anywhere from 120 a session to they could charge anywhere up to $350 a session. Now, most individual, like one-on-one sessions, which is just you and the therapist, they can range from anywhere from 120 to about 250. Now, if you're doing relationship, that might cost a little bit more. If you're doing family therapy, that might cost a little bit more too, just depending on what you're looking for. But always talk to that therapist, the person you're gonna think you're gonna work with. Again, there's a sliding scale too, and you can talk about pay through that. So, what happens in the first session? I think I talked a little bit about it earlier. The first session is when you meet with your therapist. You talk to them over the phone before, and then you meet up your first appointment. That can be it can bring your anxiety way up. Be the first time, especially if it's your first time going to therapy. And to be honest, when I was as a therapist myself, meeting someone very first time with a new client, that also brings anxiety. I'm also anxious. I have anxiety too during that time, which is normal. Most therapists during the first session, they ask questions. They do ask questions about medical history, mental health history. It's called an intake. That's what it's called, is an intake. They ask you a series of questions about your medical history, mental health history, family history, use of drugs, alcohol, um, your address, what are you looking for, um, things like that. And usually the first session, the intake, is usually the longest session. Can average anywhere from 1 hour to about 90 minutes because they have all these questions they have to ask for intake. And that's usually a little bit more if you're private pay. That's going to cost a little bit more. Now, if you have insurance, you can use insurance, and the therapist, psychologist, whoever it may be, they'll get paid a little bit more because, again, that's the longest session because they're asking all these questions. All these questions they're asking will help them with your situation, to help them know more about you, about what's going on. Also, during the first session, they usually talk about a therapist will talk about their own style. Once you let them know like what's going on, they will say, what, this is what I think I'll do. I use a lot of cognitive behavioral therapy and motivational interviewing. That's what I usually use. Other therapists use something else, and that's during the first session. This is what I'll do, and I also explain to the other person like, hey, that I might have homework for you to do. This homework's gonna be simple. It's usually homework that relates to what the session was all about to help you improve your situation. If you have concerns about anything, that's when you usually ask the therapist or any session. If you have a question, ask. Always ask. Some uh, Another question you might ask yourself: will I receive medication if I go to therapy? Um, that's Medication is often used with conjunction with the psychotherapy, especially if there's cases of severe depression, bipolar, anxiety. But again, it's not medication is not for everyone. That's another thing you would talk to with your therapist. So a mental health therapist, a master's level clinician, they cannot prescribe medications. A psychologist cannot prescribe medications. The only people who can prescribe medications are your primary care doctor, a psychiatrist, or a nurse practitioner, because they all went to like med school, or they did all that medical training at med school or anything like that. A therapist like myself, I cannot prescribe medications. A psychologist cannot prescribe medications. A psychologist, they got their doctorate degree, um, but they didn't go to med school. I know some people are confused about that. But if you feel like maybe medications might help out a little bit more, talk to your therapist about it. Some therapists do collaborate with psychiatrists. If they don't, they can definitely help find you a psychiatrist or a or a nurse practitioner, or you can talk to your primary care doctor, and they can talk to their primary care doctor, and you guys can correlate that way. Also, before you do any of that, if you want the therapist to talk to your primary care doctor or psychiatrist, if you have one already, you need to sign a release of information, because that's another thing you would do in your first session is sign a bunch of paperwork. Um, I hope that makes sense. So again, medication is used in conjunction with psychotherapy, but not in all cases. It depends on what you're struggling with. And then you would see the psychiatrist um, or nurse practitioner as well as your therapist at different times, of course. You wouldn't see your therapist and your nurse practitioner or psychiatrist at the same time. You would see the psychiatrist or nurse practitioner at a different time. Most psychiatrists, if you have one, you see them maybe once every 3 months. A nurse practitioner, kind of the same way. Whereas a therapist, you talk about your mental health issues or anything like that, you see them starting out at once a week. Once, maybe sometimes twice a week, but usually it's about once a week. Another question is, when would therapy end? Oh, that's a good question. That all depends on the person. Usually by the fifth or sixth session, that's when most therapists kind of, discuss what's going on, kind of see where we're at. Also, that's where we do our look over the treatment plan. A treatment plan is usually done in the first session with intake. Treatment plan consists of goals and things that you want to do, that you want to achieve while in therapy, stuff like that. Usually by the fourth to sixth session, that's when they look over that stuff, and then they kind of figure out this is what we achieved. This is what I need to work on yet. It all depends on the person again. It also depends what you're going to therapy for. Sometimes the therapist may think, you know what, I've done as much as I can. You've improved quite a bit, and I feel like you may not, you you may you may still see me. You may want to still see me. Maybe instead of once a week, You see them like once a month or twice a month, every other week. That usually happens with clients I've seen too. The first 5 or 6 sessions, usually weekly, and then eventually it'll go to every other week for a while, and then we look at things, collaborate. Hey, we're doing well, and then maybe it's like once a month, and eventually we don't have to see you anymore. You don't want to see us or anything like that. But you also mention, hey, if you feel like you need to see me or see a therapist, please give us a call. Again, it just depends on the person and what you're going to therapy for. So the last things I want to talk about are 4 ways to get more out of your therapy session. The first one is I talked about this during the first like 15, 20 minutes. Find a therapist you click with. Find a therapist you can connect with. Eventually after about 2 or 3 sessions, you guys kind of click, kind of connect. You have a therapeutic relationship. You build rapport with that client or that therapist. You'll know, your gut will know that you will click with that person. If not, you can then find another. Just let the therapist know and say, hey, you know what? I don't feel like this is right. I don't feel like we're clicking at all. I need to find someone else. Most therapists will understand. Also, clarify your goals for therapy. These are your goals. These aren't the therapist's goals. These are your goals. These are the goals you want to achieve while you're in therapy. These are not the therapist's goals. Therapists can kind of help you find goals. It's kind of you talk and say, hey, you know what? I feel like I need help finding some goals, and then you talk to the therapist. You know what? This might be a good idea. This might be a good idea. But these are your goals. Clarify your goals in therapy. Your goals are usually on the treatment plan. When you're not in session, write down things that you want to talk about in therapy. In between sessions, write something down. Put it in your phone. I do that quite a bit too when I got my appointments. And like something comes up, you know what? I need to talk about this. So I know the iPhone has a notes app. So I put it in the notes app. So then I'll remember it when I go to see my doctor. And then you won't forget. Do that. Write it down somewhere. Even in a notepad you take with you if you have a notepad. Write it down. So you know what? I got to think about this. I got to talk about this. Write it down so you don't forget. If homework is given, there's a reason why if homework's given during the session. Please do the homework. It's usually homework something related to what you guys are talking about during your session, like coping skills, meditation, anything like that. But if a therapist or psychologist says, you know what, I want you to do some homework, this is what I want you to do. Also, you can write it down. Say, you know what, try meditating for about 5, 10 minutes a day or at night or something like that. Write it down. Or sometimes there's a homework sheet that the therapist or someone gives you. Make sure you do the homework. There's a reason why it was given to you. And those are the top 4 ways to get more of your therapy sessions. Now, there's other things you can do too. So make sure you get more out of your therapy session. These therapy sessions, it's an investment. It's it costs money, but even if you're using your insurance, you still pay for your insurance. So it's an investment. It's time consuming, and just make sure since you're going, get something out of it because you're going to therapy for a reason. I hope you learned something today. If you have any questions or anything, you can reach out via my Facebook page, A Path to New You Facebook page. Um, this podcast is available on most major platforms. I believe next Friday I have a guest coming on the podcast, a hypnotherapist, and we're going to be talking about that. And she works with clients who are um, dealing with trauma. So she uses hypnotherapy for trauma. So we're going to be doing that. I believe that's next week. I'll be posting something about that on the Facebook page as well. And if any of you who are listening have questions for me to ask her, you can comment below the post and I'll ask those questions. Anyway, again, you were listening to A Path to New You. Usually I do one episode a week, but the last month I've been extremely busy doing things. And hopefully I want to continue doing at least once a week. Until next time, take care.